In this video, we'll learn about various things that we drop in syringes and inject into the patient. The categories include anesthetics, normal saline, steroid, and of course the calcium chloride that we use for PRP. Starting with the anesthetics, it's important to note that we have the bicarbonate. The bicarbonate is only to dull the sensation of burning because the anesthetics are a little bit acidic. This by itself does no numbing. We only add this to our big surgery cases where we have the big 3 ml syringes. Next, we have lidocaine, 2%. And notice this is just pure lidocaine, no epinephrine. We also have lidocaine. This is xylocaine or lidocaine, that's just the trade name, 2%. And notice in red it says epinephrine. It's really important because some patients might be allergic to epinephrine, so we avoid that. We also avoid that in pregnant people. And we never put this in our fillers because we never ever want to see the blanching that can be associated with an occlusion. So whenever we put numbing into like Sculptra or any of the fillers, we just use plain lidocaine. For biopsies and surgeries, we use lidocaine with epinephrine because the epinephrine helps constrict the blood vessels, so it helps with bleeding. So when we cut the skin, like in the case of biopsy or surgery, it's helpful to have the epinephrine. We also have xylocaine 1% with epinephrine, and notice this has an X in the back. Don't touch this. This is only for hair transplant. It does not concern our staff. And finally, we have bupivacaine. And that's a different kind of anesthetic, and that is used for our PRP and is not in our normal injection. The way we use our anesthetics is we have 3 ml and 1 ml syringes. This is an example. You can see it says lidocaine 2% with epi, which is this. And we have a label for it with the expiration date and the lot number, and it's capped in these little syringes, and they're found in the rooms, but they're also put in our biopsy tray, so when we do a biopsy, everything is ready to go. Another place where you will see the lidocaine with epinephrine will be for our surgeries, which I showed you earlier, which is the big 3 ml syringes that we use for surgery. We often use this for our fillers like Sculptra, and if you're ever in doubt, please make sure you ask before you mix anything. Moving from the anesthetic, we're going to talk about normal saline. Notice that this is bacteriostatic saline, 0.9%. You never want to use something that's more concentrated. It actually will cause the tissue to die. Because we use this to dilute things, we have to make sure that we have one that we devote to Sculptra, which is a filler, and we never put it or draw anything else from that. We have one for Botox, Dysport, and any of the neuromodulators, and we want to make sure we only use it for that and nothing else. It's not contaminated. And then we have one that you can see the date is the date that it was opened, and it's for drawing up everything else. The next category of injectables is steroid. Kenalog is the trade name, but if you look closely, it says triamcinolone. It comes in 2 flavors commercially. One is Kenalog 10, and the other one is Kenalog 40. Of course, 10 is weaker than 40. We often inject these directly into the skin, or we use a little bit of this into a bottle of normal saline. And notice it says Kenalog on it because it's no longer just normal saline. It now has Kenalog from here put into here, and it's a very dilute Kenalog. And we use this to make our cortisone injection. So a lot of times patients come in with cysts and whatnot, and you can see that it says TAC, again, expiration date, and these are drawn up, and they look just like the lidocaine with epi, but they are placed with a label into every room. So if we ever need to do a cyst injection, we're drawn from here. And then the biopsy trays are also placed in the room, but we have to make sure never ever these two are confused. And that's why labeling every syringe is really important. And finally, our last injectable is the calcium chloride that's used for PRP.